Good evening, everyone. I'm Alan Fisher. In the past decade, the number of veterans committing suicide has soared.
So here I am, 23 years old, retired from the Army, going through a divorce, lost my career, losing my sanity. Slowly but surely, it's going. Losing my self-respect.
On this episode of AZ Illustrated Science, we explore why that is and what the military is doing about it. Also, many Arizonans have limited or no access to medical care. We introduce you to some programs trying to make care available to everyone. But first, here's a look at today's top stories.
Senators John McCain and Jeff Flake were together in Mesa today to take immigration questions from a town hall audience. Senators Flake and McCain are both members of the Gang of Eight, which wrote the immigration bill passed by the Senate earlier this year. Some House Republicans who oppose the bill say immigrants who become citizens will vote Democratic, so passing a proposal in the House is bad politics. Senator McCain scoffed at that line of thinking. Both McCain and Flake say they're hopeful the Republican-controlled House will pass an immigration bill this year before the election season gets underway. Today is primary election day in Tucson City Wards 3, 5, and 6. But since the races are uncompetitive, the results only officially set the stage for the November ballot. Voters in the city have until 7 tonight to turn in their ballots at City Hall or one of 4 other polling places. This election is all mail-in. So far, turnout shows that independent voters are casting the most ballots. The devastation caused by the Yarnell Hill fire earlier this summer is not over. The fire that killed 19 wildland firefighters and destroyed more than 100 homes and buildings now brings the threat of mudslides because the soil in the fire-damaged area can't hold much water. And that's a look at tonight's headlines.
As the military grapples with soaring suicide rates, mental health professionals in southern Arizona are exploring the roots of the problem and how the community can help solve it. Gisela Tellis has the story.
When Ricardo Pereyda returned from Iraq, he thought his most difficult days were behind him.
This was a bad day.
But nothing had prepared him for the battle he would face back home.
It was difficult. It's very difficult when I came back. Extremely difficult. You know, here I am, I'm a 22-year-old kid, man at this point, kid. And I felt used up. I felt like, what now?
Pereyda, who had served in the United States Army Military Police, was now living with a traumatic brain injury and post-traumatic stress disorder, or PTSD. Nightmares kept him awake through the night. His days were wrought with anxiety, anger, and grief.
So here I am, 23 years old, retired from the Army, going through a divorce, lost my career, losing my sanity. Slowly but surely, it's going. Losing my self-respect, feeling like I'm a drain on everybody else.
It was then that Pereyda wrote a letter of apology to his loved ones, held a gun to his head, and came close to pulling the trigger. He would have ended his life, he says, if it weren't for the thought of his family's pain.
What kind of impact is that going to have on my family, on my friends, beyond what's already happened? And I couldn't do it. Thank God.
Pereyda survived that day, but many veterans don't. The number of service members and veterans attempting and completing suicide has been rising for the past 10 years. According to the Department of Veterans Affairs, 18 veterans die by suicide every day, far more than are killed in combat. For Dr. Michael Marks, lead psychologist of the Southern Arizona VA healthcare system, it's a problem with many causes and no simple solution.
Part of the issue that's going on is military culture. Doesn't encourage people to reach out for psychological help. Emotional problems are seen as a weakness. Reaching out can be seen as a weakness. So that ethos even follows them out of the military.
When that ethos combines with post-traumatic stress, traumatic brain injuries, drug and alcohol abuse, financial or relationship troubles, or the difficulties of multiple deployments or transitioning back into civilian life, studies show that suicide risk rises. Mark says the military is trying to change its culture in hopes that fewer lives will be lost. But he says that may not be enough. The community has to change too.
Of the people who've been suicidal that I've worked with, and I will ask them, I said, you know, okay, you're suicidal. Do you want to be dead, or do you want the pain to end? And I would tell you that 95% of the people just want the pain to end. So one of the things we can do as a community is identify what are those painful things and what can we do to make them go away.
They did a great thing. And that's
Educating the community so it can ask and answer those questions is Nicola Winkle's mission.
It's not all about deployment. It's about the things that people are experiencing that are a part of their life.
Winkle, a community liaison with the Arizona Coalition for Military Families, helped develop a program that teaches Arizonans military mental health first aid.
Mental health first aid is being used across the country to equip our communities to respond to individuals experiencing mental health crises. And what we're doing now is adapting it for use with the military and veteran populations.
The curriculum teaches the do's and don'ts of helping service members, veterans, and their families. What questions to ask, what warning signs to look for, how to talk about painful experiences. The program's pilot trainings have drawn significant interest so far.
The more people that we have that are knowledgeable, who have the confidence to intervene, and they know how to connect that person to the resources that are available, the better off we're going to be intervening in the lives of people who are feeling suicidal.
For veteran Ricardo Pereyda, that willingness to intervene meant the difference between life and death.
It wasn't for the people who loved me, who were telling me, you know, you need to seek help. You need to get out there and go to these you know, therapy programs and stuff like that. You need to talk to somebody. I wouldn't be here.
Now Pereyda helps others through their dark days. As president of the University of Arizona chapter of the Student Veterans of America, he advocates for his fellow veterans. And as hard as it still is for him, he shares his story so others will know they're not alone and that it can, and does, get better.
I want to change it for the world. You know, the experiences that have helped, you know, mold my character, who I am, what I cherish in my life, who I want to be. The different turns and twists and forks and dead ends and whatnot that I've gone through in my life have led me here. And yeah, I dig it. Yeah.
A major problem for people in communities with limited resources is access to the right mental health care. In Tucson, for example, 1 in 5 residents live below the poverty line and may find it difficult to afford care. In other areas, people may earn a living wage but have to drive hundreds of miles to get the assistance they need. New technology promises to help bridge the gap of care where it's needed most, but there are some challenges to this approach. Here to discuss the problem and its possible solutions are Lynda Bergsma, Director of the Arizona State Office of Rural Health Program, and Oli Teenhouse, Chair of the University of Arizona Department of Psychiatry. Lynda and Oli, thank you very much for joining me today.
Good being here.
Lynda, starting off, how difficult can it be for people to gain access to mental health services?
Well, For those many people in Arizona, and we'll talk about Arizona, who may be very poor, living in poverty, or even the working poor, they often don't have any mental health coverage for mental health services. And then in rural areas, that's even more so. There are people living in poverty and in difficult situations in rural areas, and there are so many challenges to getting coverage, to getting any kind of mental health care, particularly because there are very few mental health care providers out in rural areas. And so people there are largely getting medication, but they're not getting any behavioral or mental health counseling.
Okay. And Oli, how are we addressing these inequalities in mental health care?
Well, we're trying. We have the tools actually available. We have a very powerful way of reaching out through telemedicine, specifically in this case, telepsychiatry, which is like closed-circuit television, where we can connect providers, in this case psychiatrists and other mental health professionals, through television hookup with remote areas where there is a satellite clinic that could basically invite the specialist in and provide services to patients in the rural areas.
Okay. Exactly. How does this telepsychiatry work? Is it a one-on-one thing going back and forth?
It's largely one-on-one. When I've practiced it, I always like to have a nurse on the other side or another mental health professional with the patient to help smooth certain technological problems that occur, and also give some additional information, telling me how the patient came in the first place, sometimes provide some background information, and if it involves writing a prescription, it is absolutely critical to have a nurse at the other end. But basically, it's a one-on-one encounter with a patient, just like you would have in the office, except it's through television.
Okay. And Lynda, could you discuss some of the funding and financial challenges that are facing this issue?
Mm-hmm. Well, for most people, the cost of health care of accessing mental health care is much higher than accessing regular health care. It's often both rural and urban adults have a greater cost sharing for their mental health care, which is 40% of the cost as opposed to only 30% of the cost for regular health care. So what happens because of that cost sharing is, again, for people who are in poverty or have low socioeconomic status, and particularly in rural, we say the population in general is older, poorer, and sicker. And so those folks really have a difficult time coming up with the amounts of cost sharing that's necessary, and so they just don't get it.
Okay. And Oli, what are some of the links between poverty and mental health issues?
Well, mental illness is a very broad term, but a lot of mental illnesses carry a high burden of disability with them, meaning a lot of these patients are plain unable to work. Many others, though, would be able to work if they could get care more consistently and wouldn't have so many sick times out, which make them very difficult to employ for an employer. So it is a high risk for prolonged unemployment and a high risk for disability to suffer from certain mental illnesses.
Okay. And very briefly, we're almost finished with our time here. Either of you, is it difficult for people in rural areas, low-income people, to try and access? Is there a stigma involved with this in terms of accessing mental health care?
Definitely. There's a major stigma. And then don't forget also that small rural areas, everybody knows everybody. So no one wants to be seen going to a healthcare facility that might be known as a mental health care facility. And so access is very difficult also because there are practically no psychiatrists out in rural areas, very few psychologists. Rural areas are lucky if they've got like a licensed social worker or something like that.
Okay. Well, Oli and Lynda, thank you very much for joining us today.
Well, glad to have been
here. Thank you.
The U.S. military is ready to go if the president orders a strike on Syria.
Even as the Obama administration gathers international support for military action, it says the goal of any response will not be regime change. Margaret Warner has the latest on options for action in Syria.
Then we return to the March on Washington, 50 years on. Tonight, reflections from the march's last living speaker, Georgia Congressman John Lewis.
It was all inclusive. It was black and white, Latino, Asian American, and Native American. They came from places like Idaho, Wyoming. All over they were there, carrying their signs.
And we conclude our series on governing in a time of gridlock with a look at how the entertainment world sees the nation's capital.
The question we ask is if someone's actually getting something done, do the ends justify the means? It's an interesting question to ask right now when Washington is paralyzed by gridlock.
That's all ahead on tonight's NewsHour.
When the Reverend Martin Luther King Jr. addressed the March on Washington, he read a prepared speech until gospel singer Mahalia Jackson spoke up.
And she shouted at him. This is after she had performed, of course. She's sitting down. Tell him about the dream, Martin. Tell him about the dream.
I'm Renee Montagne, an eyewitness to I Have a Dream on the next morning edition from NPR News.
We now continue our look at what happens when people aren't geographically close to programs and services some of us take for granted. Such a service is dental care. While it may be easy to find a dentist in a city like Tucson or Phoenix, that is not true everywhere. As Andrea Kelly reports, a mobile dental RV is working to put dentistry in reach of school children in rural areas.
The Pima County Board of Supervisors, Freeport-McMoran, and grants from local nonprofit agencies enable the United Community Health Center to take a dentist's office on the road.
We have this dental RV that we bought 3 years ago with a grant, and we go to schools in our area of service to provide dental care for kids who would have no other way to get dental treatment.
The service area includes schools like this one in Sahuarita, plus others in Amado, 3 Points, Continental, and Vail.
Most of them, we're there 1 day a week, every week, so our follow-up on kids is excellent.
Children do have to have an appointment because the visit requires consent for medical procedures, and they miss a small part of the school day to attend.
We bring the kid in for an exam and x-rays and cleaning, and then send a consent form home to the parents for the treatment. When that consent form comes back, then we start the treatment and finish it.
Oh, look, your new teeth are coming in.
We have 2 dental chairs, 2 different separate rooms at each end of the RV. Each one is fully equipped, and we have the room that was originally designed to be the bathroom for the RV, we have turned into an x-ray room and a small desk area and a waiting bench.
All of that fits into an RV no bigger than one you might see on a road trip on Interstate 10. Ruben Acedo is one of the children who regularly visits the dental RV.
Most of the time when I come here, they clean my teeth and they check what's happening and stuff. I sit in a chair and they use like tools to clean out all like clean what they need to do and stuff.
Angelique, you want to come on in? Go ahead and take a seat right there for me, please.
His younger sister, Angelique, also comes to the dental RV for cleanings. Both can cite what they've learned from the dentists and hygienists.
If you have food still stuck in your teeth, bugs will come and eat and poop on your teeth and eat and pee on your teeth.
That description may sound unconventional, and it's not quite the whole picture of dental health, but it's the basic idea staff is trying to get young kids to understand.
They said like you should brush in like the cracks and you should always floss when you're done, so you don't have any germs. You don't get any more germs. For me, I should brush 2 minutes.
The kids get a goodie bag when their visit is over.
There's a toothbrush, an extra one if you need one. There's toothpaste if you don't have any. Flossers for you can floss your teeth. And a timer for you can know how much you need to time yourself.
The amount of care varies based on the condition of the children's teeth, just like at any other dentist office.
We see kids, some who have pretty healthy mouths, but we see many, many whose mouths are heartbreaking, and that can mean 4 or 5 or 6 visits. And we do everything. I mean, we do root canals, and we see teenagers whose teeth are so bombed out that we need to do a root canal.
It's also more convenient for families who live in rural places with less access to dental services.
If you were a mom and you worked full-time and you had very little money and your kid was in school, which would you prefer to do? Take a half a day off work, take your child out of school, and take them to the dentist when you found one that would see you, or have the RV come to your school and your child misses half an hour of class and goes right back.
So when you put your toothbrush in, you don't want to put it straight against your teeth. You want to aim it.
If kids have insurance, United Community Health Center bills the company. But Phillips says the dental program is mainly funded by local grants. She says those help the United Community Health Center reach more people.
I think what we do here is so hugely important because these children simply have no other way to get dental treatment done. And we all think that dental treatment is not as important as some other kinds of health care, but what we know now is that the infection in the mouth can be in the rest of the body, and if that becomes a load of bacteria in the bloodstream, it can be fatal and has been.
The organization's mission is to serve underinsured or uninsured residents in southern Arizona, even in areas you might not expect to need the assistance.
There are still a lot of people in this community and down in Continental that don't have money, don't live in what we perceive as Sahuarita as it has developed over the last 10 years. And there are not dentists around here locally who are geared up to treat those people.
Okay, darling, you have a wonderful day, okay? And I'll see you in 6 months. Okay.
Of course, dentists are not the only caregivers who may be scarce in rural areas. In 1976, the University of Arizona's Department of Family and Community Medicine established a mobile health program to help underserved areas get access to a wide variety of medical care services and training. In the past 30-plus years, the program has expanded to provide both mobile facilities and telemedicine, in addition to training opportunities for the up-and-coming generation of doctors. Joining me in the studio are Dr. Susan Hadley, the medical director of the mobile health program, former director Susan Woodruff, and program co-founder Martha Ortiz. Ladies, thanks so much for joining me today.
Thank you.
Susan, one goal of the mobile health program is to empower underserved communities. How do you do that?
Well, one way in which we do that is we bring the unit to the communities where there is no access to health care. So we provide point-on service for primary care, but within that community we provide training to community health workers to train the community themselves to help take care of themselves. And we also provide training to the full spectrum of health professions, anywhere from medical assistants to family medicine and internal medicine doctors who will be further hopefully providing care in these areas to public health students.
Okay. And Susan, when we talk about underserved areas, are those only rural areas or can those also include urban areas?
Underserved people live in all areas, and the number one problem in Pima County is access to care. And the rural areas we originally served and helped them to establish permanent clinics. And now we serve in some rural areas, and we also serve in high-risk urban areas. People often don't know how to access health care. And that's where the community health worker, the promotora, comes in, because they let their community know that we are there to help them with healthcare services.
And Susan, how do people access your services?
Well, we have a website that people can connect through. We have a cell phone that's on so that patients can actually call and find out where we are. And we have a Facebook through the University of Arizona that patients and people who want to volunteer with us can look at.
And Martha, how did this program get started?
Certain Reverend Ross Hanna offered an old Sunday school bus to my husband, who was a family doctor and interested in helping underserved people. So we took it, the department found some funding for it, and the county helped. We fixed it up and went to a Yaqui village near Marana, all over southern Arizona, to Vail, Picture Rocks, Amado, and so on, and asked for a small donation if people could pay it, but we didn't turn anyone away. The vehicle is still much improved now. Perhaps we have a picture of that big rig, but it has 2 examining rooms and a laboratory and waiting area.
Great, great. And Martha, how is the program currently funded? You mentioned how it was funded early on. How is it funded these days?
Yes, with all kinds of help from donors, especially through an endowment that Dr. Andy Nichols started some 14 years ago, but he wanted it to be in our name, so it's the Dr. Augusto and Martha Ortiz Endowment. Too long a name, but people do donate to the Ortiz Endowment regularly. We appreciate that very much because the university and the county help some, but they can't take care of all expenses, of course.
And Susan, there's a wide variety of services offered by your program. One of them is prenatal and birth care. Could you talk a little bit about that, please?
Yeah, I'm actually going to let Susan Woodruff address that because she started the prenatal program with the mobile health program.
We started the prenatal program about 10 years ago, and it was an opportunity for family medicine residents to learn about prenatal care. Our community health workers did the outreach, found underserved, uninsured pregnant women. They all met in a group. So we would do health education, and then the physicians would come, but the women were not separated from the group. And these women that participated have developed some really long-term relationships and have been there for each other over the years.
Okay. Well, I want to thank you, ladies, for coming tonight. I very much appreciate you stopping by today.
Thank you very
much. Well, thank you.
That's our show. To post a comment on any of these stories or to keep up with the latest news, go online to our website at azpm.org. I'm Alan Fisher, and thanks for watching.